Hi all, welcome back. Now let's resume our practice of OET reading. Few days back we had done a video on OET Reading Part A. The traps and tricks associated with Reading Part A were discussed, and we had received comments on to have videos on B and C as well. Now this video is based on OET Reading Part B, wherein we would be practicing a few questions together. So before getting into the practice, just a quick overview on what OET Reading Part B is all about. As you know, there is no exclusive time set aside for Reading Part B as such. For B and C together, you have 45 minutes. And out of that, it is recommended that you should be using to an at most of 10 minutes alone for Part B, because in Part C, you have longer extracts and more questions. So you should at least set aside 30 minutes for Part C. So the recommended time for Part B is 10 minutes. Now, what kind of questions and what kind of text you get in Reading Part B? Generally, what you get in Part B are short workplace extracts, which can be emails, memos, manuals, policies, guidelines, and so on. And based on this short extract, which would be around 100 to 150 words, the type of questions that you get to answer would be multiple choice questions. You will have 6 multiple choice questions, 6 short extracts, and based on each extract, you will have one multiple choice question. So in total, 6 multiple choice questions from Part B. And each question will have 3 different options, A, B, and C. Now, the type of multiple choice questions or the nature of multiple choice questions, or what are these questions trying to find out, can be broadly classified into 3 groups. That is, some questions will look for the main purpose of the text given to you. A text would be given and the question will be based, or the question will ask you to find the main purpose of that text. Or another category is that the text would be given and you would be asked to find the purpose of that text. Or another type is that you would be given the text and you would be asked a question based on a specific detail inside that text. So these are the 3 kinds of question types that can appear when it comes to multiple choice questions in Part B of OET reading. Now, let's get into the practice. Before that, just to make you understand on what is the difference between this purpose and main idea and detail, let me bring forth a very simple example. Now, suppose in a school, on the notice board, a notice is put up like regarding a school picnic. On the notice board, it's put up like school picnic for grade 2 students on 24th May 2025 to the city park. Then the details are listed below. That is, the students would be carried to the park in the school bus. Then the children can wear sports uniform. Then they can carry water bottles and caps and even snacks. Then please avoid giving junk food or carrying junk food. All these details are given. A simple notice on school picnic. Now, when you think of it, what is the actual purpose of that notice? Yes, to inform the students, to inform them about the picnic, to inform everyone, to let everyone know about the picnic. That is the purpose or the motive. Okay, that is what you mean by purpose. And what is the main idea? If I ask you what is the main idea of that notice, that is the main idea of that notice is the school picnic that is to be organized, that is to be held on 24th May 2025. That is the main idea, is school picnic to city park for grade 2 students on May 24th. The purpose is informing the students about the picnic. Now, when you talk about the details, there are a lot of details included in the notice, like regarding the transportation, how they'll be carried to the city park, then their dress code, then what they should carry, what they shouldn't carry. All these are details. So question can be based on what is the purpose. Now, if you have to understand what is the purpose, you need to read the entire notice. And the main idea, to get the main idea also, you have to read the entire notice. Now, if the question asks for a specific detail, then using the keywords in the question, you can search for the keyword or the synonym or something related to that through the notice. Now, when you look at the purpose and the main idea, it's just a hairline difference between the main idea and the purpose. But you need to understand what it is actually, okay? Now, these are the basics related to OET Reading Part B that you need to keep in mind. Now, let's get into the practice. Now I'll tell you the mode of practice which I'm planning to do. We'll have a few questions, 3 or 4 questions. Initially, the question will be displayed on the screen, and once the question is displayed on the screen, I want you all to pause the video, just start a timer for around 1 minute and 30 seconds and try solving the question. Now, if you have solved the question before that, you can resume the video and check what the right answer is. If you're not able to get the answer at the end of the timer, then also you need to resume the video. You should not continue searching for the answer after that. This is one important aspect that all of you should need to keep in mind. That is, you should not be spending more time on one specific question, because you might have simpler questions later on. So actually you are putting yourself at the risk of losing scores for those simple questions as well. So maximum devote around 1 minute to 30 seconds for a question. Okay, so let's begin the practice. Now, you can see the first question on screen. You may pause the video and go through the question and options. Okay. Now, let me try to explain the question, the text, and how to reach the answer. Now, what does this question ask for? The question asks for the purpose. I've already said it can be question related to purpose or main idea or any specific detail. Now, this specific question wants to know the purpose of this email, which means that you have to get an overall picture of this text. Now, what are the options given? Whether the purpose is to report on a rise in post-surgical complications. Is it to report to the staff? This mail is to all staff. So, is this email trying to report regarding a rise in the post-surgical complications? Or is it trying to explain? What is it trying to explain? The background to a change in patient care. Some change is to be introduced in patient care, and the background, the reason why this change is put in place. Is the email trying to explain that, or remind staff about the procedures for administering drugs? Or is it a reminder? Reminder means already the reader would be knowing it. It's just telling them once again as to how to administer or give drugs to the patients. So let's keep in mind, what we need to find out is the purpose of the email. The 3 options given here are, one says that it's to report about the post-surgery complications, rise in post-surgery complications. The other says that it's to explain, or it's to explain to the readers why there is a change in the patient care, and the third one says that it is remind them about the procedure for administering drugs. Now you can see here something related to post-surgical complication and reporting regarding that. Okay. Now here it is said that there has been an incidence of respiratory depression among post-surgical patients to an average of 0.5%. Thus, for every 5,000 surgical patients, 25 will experience respiratory depression. That is, they have mentioned one post-surgery complication. In general, they have not mentioned about the post-surgery complications. One specific post-surgery complication, that is respiratory depression, has been mentioned here. Now, that too, they have mentioned like up to an average of 0.5% of the patients experience this. But they have not mentioned about a rise or increase in this complication. At first place, the option says generally about post-surgery complications, but in the text they have mentioned about only one post-surgery complication, that is respiratory depression, and they have not mentioned about any rise in that complication as such. Then one more statistics you can see here is that a retrospective multi-center study of 14,720 cardiopulmonary arrest cases showed that 44% were respiratory related and more than 35% occurred on the general care floor, which means that they have given another set of details saying that out of the cardiopulmonary arrests that happened, 44% it is due to this respiratory depression, and out of that 44%, 35% is happening on the general care floor, which means that it is happening in the healthcare setting. Okay, but here again they have not mentioned about a rise or increase. That is, a comparison is not done. They've just presented the facts. Okay, they've just stated the facts, that is, there is such a huge number, but they have not mentioned about an increase as such. For that reason, we can very confidently eliminate this option A. Now, what about option B? Have you noticed any such change in patient care? Yes, if you have read the text, you would have definitely noticed that. The last line of the text, what does it say? It is therefore recommended that post-operative patients now have continuous monitoring instead of spot checks of both oxygenation and ventilation, which means that they are hinting about the change in the mode of patient care. Earlier, the patients post-surgery, post-operative patients were provided only spot checks at regular intervals, but because of this large number of respiratory related problems, that is, they have mentioned here 44% respiratory related and 35% occur on the general care floor. Because of this large number, they have decided to make a change in the patient care. Instead of just checking the patient post-operative patients at regular intervals, now they have decided to provide continuous monitoring to the patients. So this is the answer. Let's not conclude it. Let's eliminate this as well, and then we can go for confirming this. But yes, it's 99% sure that this is the answer. What about option C? Remind staff about the procedure for administering drugs. Did you notice anywhere any mentioning of how the drug should be administered in this text throughout? No, it's not given at all. So that is also wrong, which means that B is the right answer. How many of you all got it right? So I hope the explanation is clear. Okay. Here in this case, you cannot find a synonym for the words in the option in the text. You have to understand the meaning and you have to conclude the right answer. Here they have not given a synonym of change in background of patient care or anything. But the idea is that earlier they followed spot checking for post-operative patients. Now they are going to introduce continuous monitoring. And the background and the reason for that is they have mentioned therefore. Why? Why is this therefore? Because of the large number of deaths associated or cardiopulmonary arrests that are happening to post-operative patients at the general care floor. Okay. Now we shall move on to the next question. Again, the second question is on the purpose of this email. I want you all to pause the video, put the timer again for 1 minute 30 seconds and then try doing it, and then once that is over, you can resume. Okay, the purpose of this email, again purpose, which means that you have to get an overall idea of this text. Let's go through the options. Option A say that inform. It is to inform. Again, that is to all staff, okay? And the subject is regarding removing contact lenses. So this email extract talks about removing contact lenses and it is addressed to all staff. Now, what is the purpose or what is the objective of this mail? Is it to inform that lenses should be removed immediately if the patient is unconscious, irrespective of an eye injury. Even if there is an eye injury, the contact lenses should be removed immediately. That is option A. Option B says again, inform that it is the responsibility of a nurse to remove contact lenses with proper care if a patient is not able to remove his contact lenses. That is, if the patient is not able to remove his contact lenses by himself, then it is the responsibility of the nurse to remove it with proper care. Then notify. Notify means it's more or less like informing, just letting know what something has happened. Informing means explaining about something. Notifying means just letting them know so and so has happened. Now, what is being notified? Common mistakes nurses do during removal of contact lenses. Is it to let all the staff know these are the mistakes that nurses make during removing the contact lenses? So these are the three options. The question is, what is the purpose of the email? And first option says that it is to inform that the contact lenses should be immediately removed if the patient is not able to remove it by himself, no matter if there is any injury to the eye, that should not be taken into account. Then option B says that it is the responsibility of the nurse to remove the contact lenses if the patient is not able to do it by himself. And option B says that it is to let others know, all the staff know, what kind of mistakes that nurses make during removal of contact lenses. Let's go through the text and find out the right answer. Now, the first line says that if patient wears contact lenses but cannot remove them, the nurse is responsible for removing them. It very well goes with this option, isn't it so? But let's put it on hold. Let's not confirm it. This may occur, for example, when the nurse is caring for an unconscious patient. Okay, whenever that is the unconscious patient will not be able to remove the contact lens by himself. When an unconscious patient is admitted without any family present, always assess the patient to determine whether he or she wears contact lenses. Leaving contact lenses in place for long periods could result in permanent eye damage. So they are telling the consequences of not removing the contact lenses or keeping the lens in place for a long time. Leaving contact lenses in place for long periods could result in permanent eye damage. Before removing hard or gas permeable lenses, use gentle pressure to center the lens on the cornea. So they are telling how to remove it. Then once removed, be sure to identify the lenses as being for the right or the left eye. Okay, once the lens is removed, the nurse, it is already said that it is the nurse's responsibility, and how to remove has been mentioned here. Then the care or the precaution that should be, or the steps that should be taken after the removal. Once the lens has been removed, they should clearly identify whether they have taken it from the left eye or the right eye, because the two lenses are not necessarily identical, because they need to know from which eye they have removed it, so they have to clearly identify it. Then a note, a special mention is given. If an eye injury is present, do not try to remove the lenses because the danger of causing an additional injury. Already there is an injury to the eye, and if you try to remove the contact lenses, then it can cause additional injury. So the nurse should not be doing that, should not remove the lenses if an injury is present to the eye. So which means that this actually contradicts option A. Option A says that irrespective of an eye injury, the nurse has to, or whoever it is, has to remove the contact lenses. So this actually contradicts this idea, which means that we can very confidently eliminate option A. And then option C, notify the common mistakes nurses do during removal of contact lenses. Of course, they have mentioned about what they should be careful about and how they should do it, but at anywhere did they point out about the kind of mistakes that nurses make? No, this is not given at all, which means that that can also be eliminated, which means that yes, B is the right answer. Okay, now let's move on to the next question. Okay, now you can see the third question on screen. You may, if you want to practice, you may pause the video and start the timer for 1 minute 30 seconds, and once it's done, resume the video. Okay, now let's analyze the question and the text. The question says that when dealing with patients following a safety incident means any kind of unintentional incident like a fall or administering the wrong medication or administering the medication at the wrong dosage, all these are safety incident. Staff must avoid. So what they should not be doing in case of safety incidents. Okay. So when such words appear, you have to be careful to incorporate this word into the option. Only then the answer becomes complete. For instance, it says like this: when dealing with patients following a safety incident, staff must avoid saying anything until the facts have been established. So make sure that you include that idea, avoid. If you want, you can write and keep here. What does it mean? Must avoid saying anything means must not be saying anything until the facts have been established. Option B says that staff must not be speculating on the possible cause of the incident, and option B says that staff must not be contradicting what has been said by other staff. So the basic idea is that the question is the question wants you to find out, in case of safety incident, okay, when dealing with patients following a safety incident, what are the things that the staff should not be doing? The staff should not say anything to the patient until the facts have been established, or as per option B, that the staff should not speculate. Speculate as in assume or guess on what caused this incident, possible cause of the incident. Or option B says that in case of the safety incident, the staff should not contradict what other staff has said. These are the options. Now let's go through the text. Patient safety incident. Information about a patient safety incident must be given to a patient or their carer in a truthful and an open manner by an appropriately nominated person. It is said that, okay, when you're giving out information regarding the safety incident, either to the patient or to their carer, you have to give it in a very truthful and open manner, which means that, okay, option B says that you should not assume or guess things. So it is somewhat directing towards this option, but let's not confirm. Then patient wants a step-by-step explanation of what happened that considers their individual needs and is delivered openly. So patient wants to know what happened exactly, step by step. Communication must also be timely. You have to do it at the right time. Now, what is the right time? Patient and or their carers should be provided with information about what has happened as soon as practicable, which means that you should not delay to give the explanation on what has happened to the patient or to the carer. You have to provide the information as soon as possible. It is also essential that the information given is based solely only on the facts known at the time. So this again directs us towards this option. This again says that when you're giving out information to the patient, you should be providing it only based on the facts that are available at that time. You should not guess. It might have happened because of this, or I guess this might have gone wrong. No, based on the facts that you have at hand at that point, you should be giving out information to the patient or the carer. So this again means the same, but you cannot find a synonym of the words in the option in the text, but both are trying to convey the same. This option says that you should not be assuming things, and in the text it says that you should only present facts, which means the same. Okay. Now, healthcare staff should explain the new information may emerge as an incident investigation is undertaken, and patient and their carers will be kept up to date with the progress of an investigation. What they're trying to say is that based on the facts that right now, as of now, it is available with the staff, they should try and communicate it to the patient or the carer. And you have to also tell the patient or the carer that an investigation will be initiated, and based on that there might be changes in the information that we have provided and will update you accordingly, which means that you need not wait for the facts to be established. Based on the facts that are available at the point, you can reach out to the patient, and then you also let them know that based on the information that we get as per the investigation, we'll be updating you on the changes, which means that you don't have to wait. It says that the staff must not update the patient until the facts have been established. No, immediately after the incident has happened, you can reach out, the staff can reach out and then tell them that this is the situation as of now, what we understand from the facts, and the investigation will be initiated and will be updating you accordingly. So which means that A is wrong. And then they have talked about yes, given as soon as reasonably practical. Again, they are talking about the timely delivery of the information to the patient or the carer. So definitely A is wrong, and nowhere it has been mentioned regarding that they should contradict what other staff has said. No, it is nowhere mentioned. So definitely option B is the right answer. Now here, one thing in this question that you have to take into account is that words like avoid, if a negative word like such appears in the stem or in the question prompt, when you read the option, please make sure that you consider this word also and then make the complete sentence so that you don't go wrong with the idea or you don't make mistakes while choosing the right answer. Okay. Now let's move on to the last question. Again, for those who are practicing, pause the video, 1 minute 30 seconds timer, and then resume. Let's analyze the question. What title can be assigned to this extract? Now again, title. When you give title to something, it should be a word or a phrase which encompasses almost all, majority of the ideas in that extract, right? So just by reading 1 or 2 lines, you cannot assign title to something. It should reflect the entirety of that extract. So for that reason, you should be reading the entire text and then decide what the right option is. Let's go through the options. First option says that pad placements. Is it about pad placements? Children and infants for AED's administration. So during AED administration to children and infants, how pads should be placed? Is it the right title? Or how to use an AED and pad on children and infants? So now this, like, you might find similarity, but here in option A, it is narrowed down just to the pad placement. Now these pads are just a part of this AED. So option A says that this text is all about, or this extract is all about how to place the pad on children or infants. Now option B says that generally it is about how to use an adult AED and pad for children or infants, the general usage. Then option C says do's and don'ts in administration of AEDs for children. How to use AEDs for children, how do's and don'ts while using it, is the extract listing out the do's and don'ts. Let's go through the extract. It says that standard adult AEDs and pads are suitable for use in children older than 8 years. Ideally for those under 8 years, including infants less than 1 year, pediatric pads and an AED with a pediatric capability should be used. These pads are placed as per the adult, and the pads come with a diagram of where on chest they should be placed. Okay, they are saying about like when using using AED, which are to be used on adults, if you have to use the same for children, how it should be placed. Okay, it says that the pads also are placed as per the adult, just like how you place for the adult, and come with a diagram on the chest where they should be placed, and there will be a diagram showing that how it should be placed on the chest. Then if the AED does not have a pediatric mode, now it is said that all the AEDs will have the pediatric mode also. If it does not have a pediatric mode or pediatric pads, if pediatric pads are not there, then it is reasonable to proceed with standard adult AED. You can proceed with the standard adult AED. Ensure the pads do not touch each other on the child's chest. That is, if there is no separate pediatric child specific tailored pads for this AED, then you can go ahead with that adult pad for the child, but you have to make sure that the pads do not touch each other. Apply the pad firmly to the bare chest in the anterior lateral position for the adults. If the pads are too large, then there is a danger of pad to pad arcing. Then in that case, use the front and back, one pad placed on the upper back and the other pad on the front of the chest, if possibly slightly to the left. So once you go through this text, what do you understand? Are the do's and don'ts mentioned here? What you should be doing while using AED for children, or what should not be doing? No. Generally a list of do's and don'ts you don't see in the text. Then like students often get confused between these two options, A and B. Now when you look at option B, it generally says that how to use an adult AED for children and infants. But is it given in general how to use AED? No, they have not looked into, or they have not extended to any other idea. Very specifically throughout the text they have mentioned on how to place the pads alone. Like if it is a child, then it has to be placed one in front and one at the back, and where at the back it has to be placed between the shoulder blades. So very specifically talks about the placement of the pads in case of children and infants. That is, if you are using an adult AED for children or infant, how to place the pads. Then another thing it is mentioned here is that ensure the pads do not touch each other. So it's all about how to keep or where to place the pads, and it's not about the general usage of adult AED for children. Okay, so for that reason option B can also be eliminated. It is very specifically talking about the pad placement, so option A is the right answer. Okay, now with that we come to the end of this practice. Hope you found it helpful. We would be coming back with more such videos, so stay tuned. Thank you.
Medcity International Academy. Trusted hands forever.